health is not just about our body and our physical and mental, it's about our environment. And like we say, if country is well, our people are well.
Today we're up here at Ruby Point. We're welcomed on this beautiful bit of country Warramai. We've got 32 kilometres of beachfront here, and sand dune country is normally burial country, dotted with cultural significance all through that landscape.
So the research name is Research Our Way, because we really wanted to make a statement, about what it was we were doing and why we were doing it.
We're more about how to actually do this in a manner which is going to make it better for our communities. The better way in which we should be doing research is community engagement and community involvement.
This really does start to shift those power dynamics to ensure that Aboriginal and Torres Strait Islander people are the ones that get to say what gets researched, how it gets researched, who's doing the research, and we hope that has a far greater impact on our health outcomes.
Awabakal, which means one path. So, we'll have Research Our Way, and here's our one path, because researchers now have to come through this one path. The key role of the panel is to be able to look at what researchers are doing in our communities, talking to the researchers, giving them advice and tips about how to better engage with our community, and also to be able to take that to their family members or their organisations, wherever they're involved, and talk to their people about, hey, this is happening.
Yeah, so it's so diverse. We have our elders here who are our knowledge holders, and they're kind of overseeing the process, but we also have medical professionals, so doctors at a hospital, we have scientists who work in the lab, we have people who work in allied health and have an understanding of all different areas, so speech path, audiometrists, essentially a one-stop shop. We have everything in-house, and we can give feedback around every aspect of the project, around recruitment, around the methods, around communicating it afterwards.
Aboriginal people have been the most research race on the planet, just about, and the results of the research haven't been very kind and haven't been coming back to the communities. And to have a panel like this where they make them accountable straight up before anything starts is brilliant. That's the way it should be done. All kinds of research. It should all come back to community.
Ownership's a really key thing for our community to have, because we own it and we lead it, it becomes a better outcome, because we know what we really need in our community, but if we haven't got the knowledge around knowing what it's about, it's a bit hard for our community to fix it.
What we're doing is ensuring that Aboriginal peoples are in the question, so that the answers of this research actually reflect what is needed in the Aboriginal community. This is researchers' first opportunity to see how they can indigenise their research project.
I believe Awabakal's importance in the panel is around sitting and talking about how we can influence a positive change and decision making, and how we can influence where our chronic disease, where our issues, and where our health service is trying to achieve closing the gap, addressing health issues, but more importantly, listening to other voices and how they contribute in bettering the social, emotional and physical well-being of the community Awabakal serves.
I like that the community panel is representative of individuals and not necessarily organisations, so that way they can bring their lived experience and issues that are important to them that can potentially impact the way research is done now and into the future.
The biggest learning point for me has been, rather than designing projects and designing policies and then going out and seeking consultation afterwards, it's that really the change needs to be happening from within, and so we need to be embedding the voices of Aboriginal people and their experiences and their needs for their community, and also when they're in acute health care services, embedding that into our institutions and our departments.
Absolutely, it will help HMRI and the researchers and clinicians and community affiliated with HMRI to really better understand the health needs and the health research needs that our Aboriginal community needs us to prioritise. It's critical that we use and implement the strategy and make good on that promise that we've made together as a community. Then that will be a huge signal to the rest of the sector in health and medical research that this is the way to get things done.
The impact of this approach will be enormous. It will have ramifications not just for our university, not just for our Indigenous communities, but we'll have the opportunity to be at the forefront of Aboriginal health research nationally, and I hope that it gets rolled out across the country.
It's a really friendly and welcoming environment, and I'm really happy that I had the opportunity to come.
We know that research influences public policy, it influences health programs and initiatives and things that get funded, and so we want our mob to be at the core of those policy decisions and of how money gets distributed when they're working in our communities.
Other people will be able to see what we've done and how we're doing it, and they'll be able to do it in their own communities to improve health outcomes for our people, because that's the bottom line for all of this, why all of us are invested in this whole project.